everyone, my name is Allie Dunham. I'm originally from Rockford, Illinois, and my husband Luke and I just moved to Las Vegas, Nevada about a year ago, and we absolutely love it out here. If you've never been, I would definitely recommend coming to visit here. So Taylor wanted me to talk to you guys today about the reasons why I became an occupational therapist. I've been an occupational therapist for about 3 years now, and it is the most rewarding job I've ever had, and you guys are definitely in the right field, so don't give up, don't quit. It is so rewarding, and I never knew what occupational therapy was, so I definitely found out in the most interesting way. So when I was 14 years old, I was in my backyard with my best friend Hannah, and we were doing some trampoline tricks, and we were jumping on the trampoline, and she decided to teach me how to do a backflip. I had never done a backflip before. I'd done front flips before, but never a backflip. And the first time that I tried to do a backflip, I landed right on my neck in the middle of the trampoline. I heard a loud crack, and as soon as I landed, I couldn't feel anything from my neck down, and I knew that this was not good. My friend tried to help me up off the trampoline, but I knew that was not good either, so I told her to go get my dad in the front yard. Luckily, my dad knew exactly what to do, and he got on the trampoline and he held my neck in place and stabilized my neck. He had been a coach for years, and he had seen spinal cord injuries, so he knew that it was really bad, and that because I couldn't move anything, he knew right away it was a spinal cord injury. And so he had my mom call 911, and they came right away to our house. We have 2.5 acres in our backyard, and which was plenty of room for a helicopter to land. And I mean, that was crazy in itself. Just, I mean, having this helicopter come landing right in my backyard, it was nuts. And so then after that, I was airlifted to the nearest hospital right away. They did x-rays on my neck, and you know, they cut off all my clothes, and I just kept asking them, am I going to die? Am I going to be okay? And they just tried to calm me by saying it's going to be all right. And little did I know what was about to happen. So after looking at the x-rays, the doctors told my family that my injury was at the C5, C6 level, which is the cervical level of your neck. And they said that my spinal cord was about 1 millimeter away from being completely severed. And what the doctors told my whole family in the waiting room was that I would never walk again. They gave my family a 0% chance that I would ever walk. They pretty much told my family that they would need to prepare our home, they would need to widen everything, they would need to get ramps built in our house, a hospital bed. I mean, it was crazy. And while all of this is going on, you know, I'm completely knocked out on a ventilator, on a feeding tube, just and Taylor will show you a picture of me when I was on the ventilator, and obviously I don't remember that, but I did wake up after a week of being sedated, and I just remember feeling trapped inside my body and just freaking out on the inside and wanting to talk to everybody and not being able to, and it's just the worst feeling ever, just not being able to move your body. I mean, and we don't realize, you know, what we have until it's taken away from us. And all I wanted to do at this moment, you know, I was a 14-year-old girl who was just at the start of her teenage years, and all I wanted to do was be with my friends and hang out, and it was almost summertime, and I did not want to be in this hospital bed on a ventilator. So after about 3 weeks on a ventilator, on a feeding tube, they were finally able to wean me off the vent, and I was breathing on my own. I was doing a little bit better, but I still wasn't moving anything, and it was still not looking very good. Well, all the doctors got together, and you know, they had talked to my family, and they said they wanted to send me to a rehab center that was in Chicago, and they said it was one of the best in Illinois. I don't know if you guys have heard of it, but it's called the RIC, the Rehabilitation Institute of Chicago, and it is seriously such a great rehab place. And I, as much as at the time I didn't like it there, I absolutely am so thankful for all the people and all the therapists and nurses and doctors and everyone there that helped me out and got me to where I am now. So yeah, I got in an ambulance with my my mom and dad, and They drove me all the way from Rockford, Illinois to Chicago, so it was about an hour and a half drive in an ambulance. I couldn't move still, I couldn't feel. It was a terrible ride. Once I got there, you know, I had no idea what rehab was going to look like. I mean, I was a 14-year-old kid. I didn't really understand what rehab was. I didn't know what occupational therapy was. I didn't know what physical therapy really was. I only heard about it from, you know, I only thought it was what old people did, but that's definitely not true. And so I get to this rehab, and, you know, I spend the next almost 4 months there, just not knowing what's going to happen next, and just waiting and wishing and wondering and praying that I would get better. And about after a month of being there, I started to get feeling in my right toe. And it was the weirdest thing. And I just, you know, because for the longest time, my brain had been telling my body to move, and my body was not listening to me, and nothing was happening right. And finally, when my big toe started to move, you know, my brain was actually telling it to, and it listened to me finally. And after that, just every single day with occupational therapy and physical therapy and speech therapy, things just started to come back, and I started to get some movement, you know, in my legs a little bit. I started to get a little bit of movement in my shoulders. My hands were still pretty tight, and I had to wear splints, you know, resting splints, had to wear those. I had to have e-stim put on my arms, and that was a huge thing that helped me regain my muscle strength in my arms and in my triceps. My triceps were the weakest thing of my arms. I could barely, you know, raise my arm up to extend it, and it was awful. So, but those things really helped me a lot. And just going through rehab, you know, I had my days where I just wanted to quit and I wanted to give up so bad. But my therapists were so encouraging, and they were so great, and they would make therapy fun. And it wasn't just about, oh, do this exercise. It was about function, and it was about what I wanted to do and be able to do again. And, you know, they really looked at my life and what I used to do. And, you know, as a teenager, I wanted to be able to put on makeup again. I wanted to be able to dance again. Dancing has always been a passion of mine ever since I was a little girl. When I was 2, I was in my first dance recital, and from then on, I did not want to leave the stage. I loved singing and dancing and acting, and I've been in musicals my whole life. But then, of course, my accident happened, and my dreams were kind of crushed, and, you know, I was realizing this might not happen again, and that really sucked because dance is so important to me, so I wanted to be able to dance again. And the therapists that were at the rehab center, they took that into consideration. They looked at what my occupations used to be and what things I loved to do, and they helped me to do that again. And we would even do some standing activities with, you know, music on, where I would sway, and it would be a little bit like dancing. So it was definitely helpful having them look at those things. Finally, after months of rehab and, you know, wanting to quit, wanting to give up, I finally started walking with a walker. And the first time I took steps was in the parallel bars, and I took about 6 to 8 steps in the parallel bars, obviously with a lot of assistance. And that right there just told me that I was going to get better. I wasn't going to give up. I was determined, I was motivated, I was ready to get back into dance. And by the time I left the rehab center, I was walking out of there with a walker. And it just amazed everybody there. It amazed my family. It amazed me. And just with all the prayers and all the support that I had from the therapists and from all my friends and my family, I mean, it was all what made me walk again. It was the determination. It was everything. So it was amazing just to walk out of there and know that that I might be able to dance again someday. Now I'm able to dance again. I've been in multiple musicals since my accident happened. I am able to climb mountains with my husband, with my friends. I love to be active and be outside and ride my bike, and I just love to just use this body, you know, that was given to me, and I don't take anything for granted anymore. And I just love to perform, and I'm going to continue to perform and be on the stage. And I'm, without occupational therapy or physical therapy or, you know, the rehab that I went through, I wouldn't be able to be doing those things. So it's really exciting. And then when I decided to go to college, I didn't really know what I was going to major in, and I had some ideas of, you know, I wanted to do something with helping people, but I didn't really know what to do. And I really liked my psychology classes, and I had talked to one of my psych professors, and she actually said, well, if you major in psychology, you could go to grad school and become an occupational therapist. And I mean, when she said it, it was like, ding, like the light bulb went off, and I was like, duh, like, why don't I become a therapist? Like, I didn't really know like what it would take, but I was willing to do whatever it would take. And as soon as she told me that I could go to grad school for that, I was set. I knew exactly what I wanted to do. I wanted to help people recover and get better from whatever they may be going through. And so my first job out of once I passed the boards was in the school as a pediatric therapist. And it wasn't exactly what I wanted to do, but it was a start. And it didn't matter because all I wanted to do was help people. So I didn't really care what age group I was with. And it really was just exciting just to see these kids and see the needs that they had and be able to help them to do some things again and to write again, and kind of brought me back to what I was going through. And it really did just help me to talk with the parents and just be really empathetic with them, you know, and say, I know that it's tough. You know, I went through an injury and I had to go through rehab, and it's tough to watch your kids, I'm sure, go through things like this, but I really want to just help your kids out. And then, so I did that for 2 years. And then when my husband and I moved out to Vegas, I worked at an outpatient pediatric center. Also loved that too, and loved just being able to see the different injuries of these teenagers and kids and help them out. And then the job that I'm currently at right now, I work in a skilled nursing facility in the rehab part of it. And so I get to work with the elderly, the older adults, and I absolutely love it so much. And I love getting to just make them smile. And a lot of these elderly people, they don't get family to come visit them. They don't get, you know, they don't have friends to come and, you know, play cards with them or do what they used to do or play bingo or whatever. And so they love having us there. And a lot of them, you know, they haven't had spinal cord injuries. They haven't had things like what I went through, but a lot of them have had strokes. A lot of them have had hip replacement, knee replacement, traumatic brain injury. And it's just amazing to be able to see where they start and just be that person that can look at what occupations they used to do and just motivate them by using those same things, whether they used to be a gardener or they like to play golf, and, you know, using different modalities just to help them out, and just be there for them and reach out to them when they're feeling down and encourage them and tell them not to give up. Because I mean, I hear it all the time with them. They say, I can't do this, or I don't want to do this, you know, I give up. And then I tell them my story, and I say, no, you can do anything you set your mind to. You just have to keep going, and you have to keep trying, and you might fail, but you have to just push through the pain and through the hardships. And it's just really cool, you guys, to see the progress that these patients make, and see where they started, and that you could be a part of, you know, their future and where they're going, and seeing them get back to normal again, or even be able to do things that they never could do before is just the most amazing feeling ever, you guys. So yeah, I'm just really excited to keep sharing my story with people, to keep on doing therapy in whatever setting, because you know there's so many different like areas that you could work in for occupational therapy, and whether it's with kids, whether it's with adults, whether it's with you know, teenagers, whether it's at a rehab, an outpatient, an inpatient, hands clinic, guys, you are going to be helping these people so much. And so just listen to their stories, listen to what gets them fired up, learn about them, and just be all in, you guys, and just give it your all, give it your best, and you guys will do great in this. So I'm really glad that Taylor asked me to share with you. If you have any questions for Taylor, you can ask her, and she will let me know through email or text message. Yeah, just keep going, keep pushing through. You guys have got this. I'm super excited for you guys to finish out and become occupational therapists, because it is the best job ever, you guys. So, all right, have a great day, and I hope to maybe come visit and see you guys. All right, bye.